What is the link between ADHD and depression, and how do you treat both? Hi, I'm Dr. Jodi Gold, a pediatric and adult psychiatrist, here to answer the internet's biggest questions about ADHD and depression. Can you have both ADHD and depression? So yes, you can have both ADHD and depression. Treated ADHD does not directly cause depression. However, the symptoms of ADHD can lead to depression. There are those people that have depression that's caused by the symptoms of ADHD, and there are other people that just have both ADHD and depression. What's the link between ADHD and depression? So having ADHD does increase your risk of depression, but what's really important to know is that it's the symptoms of untreated ADHD that can really cause depression. If you're feeling disorganized and late, if your relationships are all over the place, you can't hold a job, or you're constantly feeling shameful and worried when the next shoe is going to drop, all of these things would make anybody depressed. So the first thing you need to do is take a step back and understand how your ADHD might be causing you to be depressed. And once you recognize that, it's more possible to treat it. And treating these ADHD symptoms can actually help with the depression. It's important to get treatment for both, but understanding how your ADHD might be causing depression is the first step. How can you tell the difference between ADHD and depression? It's true that sometimes symptoms, they can overlap. Sometimes symptoms of depression can look like ADHD, like not being able to concentrate, feeling agitated, being withdrawn, or forgetful. Those are symptoms of depression that can look and mimic ADHD, but it's critically important that we don't misdiagnose a real depression as ADHD. So at the core, depression really is about sort of a sadness and hopelessness. While you can have chronic ongoing depression, most depression is triggered by something and comes and goes, even though it may come back. With ADHD, this is a sort of an ongoing, what we call chronic struggle. So sometimes that can help. But it's critically important to figure out the differences because the treatment is quite different. How do you treat ADHD and depression? So this is pretty straightforward for me. Obviously, both disorders need to be treated, but there's a hierarchy here. If you're concerned that you have depression at all, we always treat that first. The first and foremost is making sure that you're safe, that you're not feeling hopeless or suicidal, and that's the first step. The key to that is that if you properly treat the depression, you get the help you need, whether it's therapy, meds, family support, it really will have a huge impact on your ADHD because people that are depressed really can't manage their ADHD. Even if they're on the right meds and even if they have the world's greatest support system, if you're suffering from depression, you're not going to have the energy or the focus to take the steps you need to feel present and engaged. So the key is take care of yourself first, make sure you're safe, treat the depression, and the ADHD will follow. Not sure where to start when it comes to learning about ADHD? Our expert resources can help. Subscribe to our channel. Can depression medication help ADHD and vice versa? So the short answer is no. Depression medication does not treat ADHD, and ADHD medication does not treat depression. However, treating the symptoms of depression can make it easier to manage your ADHD, and treating the symptoms of ADHD can often make depression better. Now, you may have heard that there's medications out there that are marketed for both ADHD and depression. And the truth is that that is somewhat true. However, they're not the first line, and to be honest, they're not always the best treatment for either one. And in the case of depression and ADHD, I feel really strongly you need to treat the depression first and treat it well, and then treat the residual ADHD. How can I manage my ADHD while depressed? So it can be so hard to have ADHD and depression, but I want to be really clear. There's a hierarchy here. If you're feeling sad, lonely, or depressed, it's most important to treat that first and foremost. And the ADHD will get better once you've treated the depression. But having said that, it's easy for me to say that. When you're depressed, it can feel like it's never going to end. And having ADHD can actually make it harder to get treatment because it can be harder to make those phone calls, harder to be organized for appointments, harder to reach out. So as someone with ADHD that may also be depressed, it's even more important that you advocate for yourself, that you ask people to help you. Maybe that's just making a phone call or getting to an appointment on time, but asking for help, taking a pause, taking a break if you need, and recognizing that you have have to treat the depression because untreated depression can be very dangerous. So it's critically important that you get help if you're feeling sad or depressed and recognize that the ADHD piece will get better as you properly treat the depression. If you or someone you love is having thoughts of suicide, don't keep it to yourself. Help is available. The National Suicide Hotline offers free confidential support 24/7. Just dial 988 to speak to a trained counselor or go to 988lifeline.org. Hey, you made it all the way here. Thank you so much for watching. If you want to help make a difference, please like the video and subscribe to our channel. You'll support Understood's mission of making sure that 70 million people with learning and thinking differences like ADHD and dyslexia can thrive.